Hello, my name is Sierra Pressler, and this is my demonstration speech. Have you ever wondered what happens to your dog when you drop it off for surgery at the veterinary office? Well, I am here today to go over that process with you in the case of a dog spay. This will not be something that you can do at home, unfortunately, but I will give you all the information so you know what is actually happening to your pet. The preoperative and postoperative care for every patient is essentially the same, but it's the surgery that is different for every patient depending on that pet's needs. I have worked for a couple of veterinary clinics over the past 3 years and have taken part in several surgeries, including dog spays. According to a journal that was written by DVMs, which are Doctors of Veterinary Medicine, Dottori and McCarthy, the term spaying is a general term, and the more technical terms are ovary hysterectomy, which is where you remove the uterus and the ovaries, and ovariectomy, which is where you just remove the ovaries. I will be talking exclusively about ovary hysterectomy because that is what is widely used across the U.S. No one really knows when the first spay was done, but everyone can agree that it was done because of overpopulation of animals, unwanted pregnancies, diseases associated with non-spaying, and too many animals being euthanized. The preoperative care is essential in any surgery because we must make sure the patient is prepped and the surgery site is sterile before the DVM enters the abdomen. We prep them by sedating them, and we make sure the surgery site is sterile by scrubbing the belly area, or the abdomen. The second step in having a successful surgery is the surgery itself, and this is done by a DVM who will enter the abdomen through an incision and will end the surgery with closing up the skin using suture. The last step in the surgery process is the postoperative care, and we accomplish this step by making sure that every patient wakes up from the surgery and is comfortable and ready to go home. Today I will be showing you how to do a dog spay in 3 simple steps: preoperative care, the surgery itself, and postoperative care. First, I want to start with what happens during the pre-op care. During the preoperative care, there are several tasks that have to be done, and they have to be done carefully to ensure the safety of each patient. First, you want to weigh the patient. Calculate the dosages for the sedation, the antibiotic, and the pain injection. Pull those dosages up into a syringe, and then you can sedate the patient IV or intravenously. Insert a gag between the canines, which are the dog's teeth, in its mouth. Then you can pull the tongue out slightly and hold the head upward, which will allow you to insert the tracheal tube. Tie the tracheal tube to the roof of the dog's mouth, and then once you tie it there, you can then tie it either around the snout or behind the ears to help it hold it in place. You can then put the dog on its back, where you can connect the tracheal tube to the isoflurane, which is the general anesthetic, and the oxygen. Inflate the cuff. Attach EKG wires to 3 locations, between both armpits and in the right crease of the back leg. Shave the dog's belly, scrub with betadine, then scrub with alcohol. All of these preoperative steps must be followed precisely to ensure a sterile environment before the doctor can even begin their surgery. Next, I will explain what happens during the surgery place. The doctor must be able to perform calculated and precise steps during the surgery to successfully complete a dog spay. First, they will want to cut a small incision under the umbilical cord. Remove a small layer of fat so they can see down into the abdominal wall muscles. Cut through the midline of the abdomen, which is where you will see the linea alba, and then enter the abdominal cavity. Then you want to ligate, which means to tie off the ovarian pedicles and the uterine body. Then you can cut the ovarian pedicles and the uterine body, which then allows you to remove the uterus and the ovaries. Then you can suture the abdominal wall, suture the fat layer, and then suture the skin layer. All of these surgery steps must be followed in a precise order to ensure a successful surgery and the well-being of each dog before they can wake up. Lastly, I will explain what happens during the postoperative care. The postoperative care is essential to make sure the patient is healthy and that there were no issues with the surgery and they are ready to go home. You want to give the patient their antibiotic and pain injection. Remove the patient from the general anesthetic, which is the isoflurane gas, and the oxygen. Then remove the EKG wires from the patient. You can then tap on the patient's chest, which will help them wake up, and then you can remove the tracheal tube, but only after they have swallowed twice. You can then carry the patient back to their cage where they can continue to wake up. The owner is then called once the patient is standing and fully awake. The patient is now ready to go home and is happy to do so. These postoperative care steps must be followed carefully so that every pet can go home healthy and happy. In conclusion, all of these steps are a necessity in a safe and successful spay. A dog spay as complicated as it may seem, can be very safe in a routine operation. I just showed you how to successfully spay a dog in 3 simple steps using preoperative care, the surgery itself, and postoperative care. The essential steps in the preoperative care, like shaving and scrubbing the injury site, are important for a safe and sterile environment. The surgery steps, like the opening of the incision or the final suture, must be followed carefully and with a precise touch to ensure the well-being of each and every pet. Waking the patient up during the postoperative care is very important in ensuring a healthy pet and making it so they can go home and that the surgery was a success. Nobody really knows when the first spay was done, but it's a necessity to help prevent overpopulation and to prevent so many more animals being euthanized. Laura Sanborn, who has a master's in science, wrote an article which showed the long-term health risks that come with and without spaying your dog. And she concluded that spaying your dog has shown severe reduces risk of several illnesses like pyometra, which is where the uterus will fill up with pus if they are not spayed, and mammary tumors. Now, if someone ever asks you if you know what is happening behind the scene when you drop your dog off for surgery, I hope you can now say yes. Yes, I do. And now I conclude this speech.